Portions of the Mike Gallagher Show are brought to you by Americans for Prosperity, and there's a summer initiative that I want to tell you about, and to join me to help tell you about it is Lauren Stewart. She's the Senior Federal Affairs Liaison for Americans for Prosperity. Lauren, nice to have you on the show today. How are you?
I'm doing great. Thank you for having me.
My pleasure. Tell us about the goal of Americans for Prosperity's summer campaign focused on health care reform. This is going to be front and center. Trump and Harris are going to debate this. Let's dive into AFP's summer campaign. What's it all about?
Fantastic. So, Americans for Prosperity and myself believe that all Americans should have a personal option in their healthcare. That means going to see the doctors that you want. That means patients are empowered with the knowledge and the dollars to be able to drive their healthcare. So, our summer campaign was called Scoops and Solutions. We related a personal option in healthcare to a gourmet Sunday bar. Imagine
Hmm.
if healthcare could be like walking into your favorite ice cream store and saying, today I'd like cookies and cream with chocolate sprinkles, but maybe tomorrow or my friend I'm with would really like chocolate with peanut butter syrup or things of that nature. Right now, what we're really feeling in healthcare is that it's just straight plain vanilla and it costs a lot. And the level of satisfaction with the cost and the quality of healthcare we get is that of someone getting just plain vanilla. Or, I won't single out my vanilla ice cream lovers out there, but maybe it's sugar free or fat free. It just doesn't taste all that great for the amount that we're
Mhm.
spending and the health outcomes that we're getting. So throughout this past week, we've been on Capitol Hill. We've brought direct primary care doctors to talk to members of Congress about their model concierge care, where they don't take insurance and are able to treat your cancer for $50 a month, or maybe your prescriptions are close to 90% cheaper than they would be with going through insurance. So really just exposing all of the options that are out there, the innovations in healthcare that right now the government is really keeping out of the hands of patients as consumers in healthcare. So all week long we've been driving the personal option and playing it into the Sunday bar, so the scoops and solutions aspect.
And you've got quite the easy to remember website, personaloption.com, that I want everybody to
Yes.
go to, personaloption.com, to learn all about AFP's efforts to to give people an option here. And look, let's face it, Lauren, all of us either had somebody in our lives or ourselves personally have dealt with our broken healthcare system. And I love the fact that AFP is sort of embracing, saying the quiet part out loud. Our healthcare system is broken. I had a dear friend, very close friend, who just went through a couple of months ago a near, well, really a near fatal health
Mm.
situation. It was something I've never witnessed before, except for obviously my wife who went through cancer and lost her battle with cancer in 2008. I can't believe how bad and broken the insurance system, the lack of options, the lack of choices, the mediocre level of care where you don't
Yeah.
have a say at all. I mean, it's crazy. And so when I heard about AFP's campaign, I wanted to dive in head first because I want our audience to be mobilized. Let's go through, Lauren, how the personal option aims to address this issue of surprise billing and the overall cost transparency, because that was a major factor with my friend finding out that
Yeah.
there were hidden costs and ridiculous costs that were completely hidden.
Yeah, absolutely. I mean, to your point, when we talk about the level of dissatisfaction, we talk about how every American, either themselves or has a friend, a family member who has been through and had to experience the disastrous areas of our healthcare system. And what is at the root of that is that we are funding and empowering insurance companies. We are funding and empowering government bureaucracies in the system over empowering patients. So you don't have the information that you feel is necessary to make healthcare decisions. Thus, last year, we found that over 40% of Americans delayed medical care because they were concerned about cost. They were concerned about surprise billing, and they're putting off taking care of themselves because A, it's too expensive, or they don't know how much it is. And look, right now, we're experiencing the single largest jump in medical expenses in nearly a decade. When we talk about transparency and when we talk about making things more open and driving the knowledge and empowerment of patients as consumers of healthcare, we are consumers of healthcare, right? It is a service, it's something that we're going to need to pay for. But it's because the golden rule, really, Mike, he who has the gold makes the rules. And in American
Right.
healthcare, the insurance companies have the gold. So they're going to make all the rules as far as what doctor you can see, when you can go see that doctor. So the way we address that is shifting the power from insurance companies directly to the hands of patients. Let's let patients control more of the dollars that are spent on healthcare in this country. And I know I don't need to tell you or your listeners, but it's quite a bit. So, things that we drive for are expansion of health savings accounts. Health savings accounts are just like a 401k, but for your healthcare. You're able to use it on qualified medical expenses and it's tax advantage dollars. Now, the self pay model is something that insurance companies have been really able to scare folks off of. But I found in my own personal experience and many of my friends that when we, say go to the doctor and have a broken foot and they go to hand you a boot to put around your foot while it heals and they say, okay, that boot will be $270 with your insurance. And you say, hold on. And you go on your phone and you look at the Amazon HSA, FSA store, which is something that is nationally available to everyone, and you find that same boot for $40 and you pay cash. So we're really more about shifting the dollars. And that's where the power comes from in healthcare, right? Is who's paying. And arguably it comes from that in everything to the patient and out of the hands of insurance. Now, the surprise billing is because it is a surprise, not only just to patients, but to your providers as to what your procedure is going to cost. I could walk in as a self pay. And the procedure, the MRI is the same for self pay across the board. If you walk in with your insurance, they'll say, okay, well, maybe your insurance is $1,300 for that MRI. The next person comes in with different insurance, their MRI is $2,000 and your copay is $300. So it's all about who's paying and where the power is getting shifted. And right now, the government, especially under the Affordable Care Act, has put all of the power in the insurance companies by subsidizing them.
Our guest is Lauren Stewart. She's Senior Federal Affairs Liaison for Americans for Prosperity. I urge you to go to personaloption.com because this is so important, so crucial. We're all impacted by healthcare in America. And Lauren, as our audience goes to personaloption.com, let's go through that, what that call to action means, what people can expect to find, and what you would like from our audience. What's AFP looking to do?
We're looking for our audience, number one, to know that healthcare doesn't need to exist the way it is now, and that the status quo, through innovation, through amazing free market forces that have brought new business models like the direct primary care model I mentioned to life, like telehealth, right? A really big component, a positive component that we got out of the pandemic, as well as the health savings account, which is a fairly new to the market health benefit. So number one, that there can be a personal option in healthcare. And right now, only a certain portion of us are able to access those innovations. And we don't think that should be the case. What you'll find at personaloption.com is a number of lawmakers who have endorsed this plan on Capitol Hill. That's where the landscape is a little bit different than the last time we really addressed healthcare, is that Republicans have solutions in this space. They have solutions, something that they can be for in healthcare, and policies that will tangibly impact the lives of American patients for better. So you'll get to see all of the lawmakers who are on board with us there. Additionally, the personal option isn't an idea or concept only endorsed by Americans for Prosperity and lawmakers. It is endorsed by a number of providers, and it is exactly what voters across the country have told us that they want. 80% of voters say that they feel trapped in their healthcare, and the one thing that they want is more options. We won't mandate you, and we're not advocating for anyone to be mandated in any one size fits all top down style plan. It's simply about bringing more options to the health market and making it more available and accessible to more American patients. In turn, that will drive costs all the way down for everyone.
I really appreciate AFP's efforts in this. Obviously, important organization. I really do love the work you're doing here. I hope everybody goes to personaloption.com, personaloption.com. Lauren Stewart, thanks for spending a couple minutes with us here on the Mike Gallagher Show. You keep fighting the good fight.
Thanks, Mike.